The risk factors for developing breast cancer are many. In fact, just being an American woman puts you at risk for breast cancer. Age is the number one reason that people can get breast cancer. But other things can go into play. Certainly family history can play a role in this. If a patient has a genetic history and has breast cancer, ovarian cancer in their family, that could put them at slightly higher risk for breast cancer. So who is impacted by breast cancer? Quite frankly, it can be anybody. Women can be impacted by breast cancer, obviously more likely than men. But believe it or not, men can get breast cancer. Women get breast cancer more than men get breast cancer, but in this country, we have about 2,200 cases of male breast cancer every year. One of the things you have to keep in mind is that it could run in families. So if there's a male breast cancer in the family, that can mean there could be a genetic reason. The other thing is you have to remember that we can see women as young as 19 with breast cancer, and we can see women as old as 104 with breast cancer. But the reality is, the earlier we catch it, the better we can treat it. So what age should women get checked yearly for breast cancer? That's a very complicated question nowadays, and many people don't want to address it. But the reality is, if you go by the guidelines, that every year after age 39, you should get a screening mammogram. That is a good way to look at it. However, you should really talk to your gynecologist about the best timing for your mammogram. Your mammogram may be needed in your 20s or your 30s. You may need a breast exam every year at that point as well. It depends on your family history. You should go by the guideline that if someone in your family had breast cancer at a young age, say age 40, you should really start screening 10 years prior to that. So if your mother had breast cancer at age 40, we want to make sure you get looked at by a breast cancer doctor or your gynecologist by the time you're 30.